So in hindsight, we should have avoided it. Am I correct? In hindsight, of course, it's easier to say that, but you would believe that we should have avoided these large gatherings even in February, March, and when it looked as if the numbers at that time in February were down, we should have still been cautious.
Yes, and I think we need to look ahead. This pandemic is not over, not going to be over for some time. So I think there are lessons to be learned from the last few months in how we manage this pandemic going forward.
I'm again going to come in a moment to the lesson, but I just want to understand at the moment, do you therefore hold the variants that are emerging responsible for this surge? There's so much of talk of an Indian variant. The UK has termed it a variant of concern. Are there, according to you, a number of Indian variants there? The Maharashtra variant, there's talk of a Telangana, Andhra variant. Do you believe that these variants of concern are responsible for the exponential rise in the Indian context?
Yeah, let me try to explain about the variants. From the beginning, since we've been tracking this pandemic, it started with what is called the Wuhan strain, or the original strain of the virus, and a big global database called GISAID, where now we have over 1.2 million sequences from around the world have been deposited there. So scientists have been able to look at this. This was taken over by the D614 strain sometime in February, March last year. So we knew that certain strains have certain advantages, particularly in the way they're able to transmit. We then saw towards the end of last year, the B117, first described in the UK when they saw this upsurge in southern UK over the period of October to December. But gradually, the B117 variant is now dominant worldwide, including in many parts of India. And the studies done on the B117 clearly show that it is more transmissible, but that it doesn't necessarily lead to very much more severe illness. There's still a debate on that. But the good thing is it's very responsive to the antibodies induced by all the vaccines we have today. Then we had the variant from South Africa, the B1351, and the variant from Brazil. And the variant from Brazil is also very concerning because of some of the mutations that it has clearly increase transmissibility and block antibodies. So these are the three global variants of concern. The B1617, which has been reported from India in increasing numbers, actually, if you look at the proportion of the 617, it is growing and outperforming the other variants in India, is on the list of consideration for the variant of concern. So we have 7 variants of interest. This one is up there, and what we were waiting for is data from the laboratory and from the clinical and epidemiological accompanying studies to see whether it's more transmissible, more clinically severe, or more resistant to antibodies. And it does appear that it will fulfill some of these criteria. We haven't officially called it a variant of concern yet. But what it means, Rajdeep, to put in perspective, I mean, the virus will continue to mutate and adapt. The way that it's transmitted is the same. That hasn't changed. It's just that it finds it easier now because it's able to multiply faster, it's attaching to the receptors faster. So it gives it an advantage to spread. But the public health measures, remain the same. And we need to make sure that we don't give it the environment it needs to spread. So this is why when I said it's multifactorial, yes, it is the variants which are more infectious, but it is also because we've had the social mixing. We've had the opportunity for the virus to transmit from one person to another. So it is always a combination of things which make the variant take off. Same thing happened in other countries as well. It wasn't just that the variant came out of the blue and was able to spread through the population. The population behavior allowed the variant to take off.